Alright guys, so this is a lecture on jaundice. In here we're talking about jaundice. So this is yellowish jaundice, yellowish of your skin. So you can have yellowish of your eyes. The cause is, what is it? Hepatic cause. The liver is the cause of jaundice. So in jaundice you have high amount of bilirubin. Okay, so there's a problem correctly with the liver itself, hence it's called a hepatic picture. The bilirubin was going to be high, and it's mainly going to be your conjugated bilirubin. Very important for the exam here is the ALT and AST. They will be very high compared to your ALP and GGT. So if these are high, you're thinking of hepatic picture of jaundice. So there are what's jaundice? Increased bilirubin. It can be from a lot of things. Hemolysis can be from obstruction, post-hepatic. In the other lecture we have done. Okay, so these are causes of jaundice from the problem with the liver itself. So very important one is going to be viral hepatitis. What is that? Hepatitis A, hepatitis B, C, D, E. All of these things are hepatitis. We will do this in detail. Alcoholic hepatitis, we'll briefly touch upon that. Drug-induced hepatitis, they're already asking the exam. Gilbert syndrome, just one line they're asking the exam. Very, very easy to sort out. Okay. Now we're going to focus on few of them. First of all, alcoholic and viral. Okay, first one, alcohol hepatitis. So this is inflammation of the liver because of alcohol. Okay, so as you can see, this patient are going to have a strong history of alcohol, and what's going to happen in hepatitis, what will be high, guys? ALT and AST is going to be high. Why is it going to be high? Because it's alcohol. Okay, secondly is that when a person has alcohol, very, very important, GGT is going to be raised. Very important. They have to have high GGT. And MCV is macrocytic anemia. They will have high MCV. So these two, very important to say, is alcohol causing, mainly focusing on your GGT. This patient, because of their drinking, they will have alcoholic hepatitis. So they will have stigmata of chronic liver disease because of their drinking problem. Okay. Treatment, obviously going to stay off from alcohol. Viral, that's the main focus of this exam, this lecture note. Okay, very important. Now hepatitis A. So the way I remember hepatitis A and hepatitis E together. So I remember as A. Why isn't this working? Okay, so I remember as A and E, accident and emergency. So I remember us together. Both of them, they're very similar. They are fecal to oral route. Okay, so hepatitis A, this is fecal to oral route, is a very self-limiting illness. Okay, can you see 2 to 6 weeks acute? So in here, in the exam, they're going to say to you, the patient has traveled abroad to a developing country, India to Thailand or wherever. They have traveler's diarrhea. They will have among the cause of traveler's diarrhea. Okay, so the patient will say that they have traveled abroad, and they didn't go like 6 months ago or 1 year ago. It's very recently. It's acute illness. It's very acute. Okay, incubation is 2 to 6 weeks time. It's going to be a acute problem. So you're going to have this diagnosis, very simple. Number 1, acute. Number 2, travel history. Okay, they probably went out, had in a bad restaurant and got some problems. Okay. Investigation, very important to understand. All you need to remember is IgM. M basically means that they have acute infection of hepatitis A. So when you do so, and IgG means basically can persist for many years. A patient has, if you think, oh, have they got hepatitis A and IgG is positive, it does not mean they have currently hepatitis A. Hepatitis A, to say if they have it now, IgM. Okay. Hepatitis A is a notifiable disease, and treatment is supportive. So people traveling before going to India or something like that, then they can have active immunization as a prevention. Okay. So hepatitis A, remember, is self-limiting. History, remember, of traveling is going to be a very obvious thing from the history. So they want you to pick up hepatitis A from history in the exam. Hepatitis E, I remember I told you guys the A and E, accident and emergency. So hepatitis A and E, they go together. They're both fecal to oral route. They're very, very similar in terms of presentation. All you need to remember, hepatitis E and pregnancy. They have seen that there is a high increased mortality in women who get hepatitis E in their last trimester compared to A. That's the only association you need to know for exam. Both of them are very similar. Hepatitis B